What if NWAC created an Aboriginal Health Research Centre and enable research on Aboriginal women's health to be community-driven? And there will be 4 questions asked. And those 4 questions will be 4 areas. One of the Aboriginal women, communities, resource extractors, and government policy.
They call me a foresight specialist. We're all foresight specialists. Every day you make predictions, make forecasts, you look ahead. And the big issues, world of change that we're facing, there are no experts on the future. And therefore, it makes sense to look ahead at what might happen that is good and what might happen that is bad. And it is even better to do that when we do it together.
Is it reasonable to think that creating an Aboriginal Women Health Research Centre could play a major role in improving Aboriginal women's health?
I think it's reasonable in the sense that the aspect needs to resonate or needs to reflect Aboriginal women's health from a current trend. We've already seen what has happened in the past. We've seen that women in communities are getting overwhelmed with being researched and then being put on a shelf. We now need to know that some of that research that we've gathered over the many number of years is going to come to life, and the recommendations that come from that are going to be the basis for which we are able to benchmark the participation of women in health. Of course, playing a major role will depend on federal, provincial, and territorial government involvement, and especially whether or not for First Nations and Inuit, despite residency issues, because that always comes up, non-insured health benefits. One of the other factors that's going to play a larger role will be those indicators which are measurable by the social determinants of health.
I think Aboriginal women can speak for themselves, not only identifying health problems they face, but also that are faced by others in their communities. I think they are able to provide culturally competent community-based research and solutions.
Yes, creating an Aboriginal Women Health Research Centre could play a major role in improving Aboriginal women's health. And I believe this true because we can design this any way we like. And I think a big component of this is providing an opportunity for Aboriginal women to be part of the research process.
I wanted to specifically talk about the need to reinstate Indigenous women as leaders in our communities in order to make change. First and foremost, that's what's needed in regards to this, especially when you're talking about Indigenous women's health. It must be designed and led by Indigenous women that's inclusive of all of our populations. That includes, the Métis, the Inuit, as many different perspectives as we could possibly include. And the research must benefit our communities, first and foremost. It can't be research driving community. It must be community driving our research and our process and outcomes. So it has to be in the benefit for Indigenous women in order for us to be able to look at what is needed.
What conditions must first be satisfied if an Aboriginal Women Health Research Centre is to effectively and sustainably contribute positively to an Aboriginal women's health?
I think if we're talking about the establishment of an Aboriginal Women's Health Research Centre, then we must ensure that the process is inclusive for all Aboriginal women, First Nations, status, non-status, Métis, Inuit, and it should reflect Aboriginal women on and off reserve, urban, rural, and those women with disabilities, both physical and mental.
It's a matter of also considering the adequate financial resources being made available to all of the stakeholders that are participating in the development of an Aboriginal Women's Health Research Centre. One of the things that gets to be overlooked is adequate dollars for social marketing campaigns or the prevention and promotion type campaigns. A lot of times, health illnesses or health-related illnesses are the highest dollars as far as being spent, but we have the lowest dollars available to do promotion and prevention type programs. or to create an increased awareness so that women can understand the issues that are reflect to their concerns and their needs. The other level of the condition that should be met is that all of the stakeholders are participating and that there's a meaningful engagement of Aboriginal women with both Aboriginal agencies and non-Aboriginal agencies that are participating in health.
I think those who are aware of colonization in Canada and aware of intergenerational trauma and the impacts, we're aware that those are external forces that have essentially, I'm going to use the word corrupted, our community value system. And they've corrupted it on different ways and different levels. All we have to do is think of Indian residential school. But the really stronger point, what excites me about this research center is that we have the talent, we have the wisdom, we have the knowledge to do things differently, and that's based on our own cultural teaching. And that is what's going to make this research center different. And that is what's going to bring us together to work differently and actually support our communities in a way that we're actually moving towards prosperity and reaching our highest potential. So I believe in the strength of our communities, but we have to clear that debris. We have to clear that debris in that Western way of thinking. So I would hate for this research center to come together and then all we do is duplicate what's happening, at CHR, the crazy processes, or recreating, university ethics processes that, you can wait and wait and wait and wait to get things done. We have to do things differently. And that's why I'm excited about this. And I do believe that there's a strong, there's lots of promise there.